Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.
Welcome to St. Louis on the Air. I'm Sarah Fentem. Let's talk about COVID-19. And I don't mean the economic fallout from COVID-19 or the efforts to flatten the COVID-19 curve or the need for equipment to protect us from it. I'm talking about the disease itself. What is it like to have it? And what does the road to recovery look like? St. Louis Public Radio health reporter Sarah Fentem found herself asking those questions. And rather than just stop there, she got answers. She joins us today to tell us what she learned. So, Sarah Fentem, welcome to the show.
Hi, everyone. Thanks for having me.
So you talked to a few people who recovered from COVID-19 or are in the process of recovering. What range of experiences did this group have?
It was interesting because, the people who know they have COVID-19 are the people with more serious symptoms because we're not testing everyone. But even people with sort of a more mild form of the disease, like they were sick for 3 weeks. And the biggest thing I heard from people, sort of the hallmark of this disease, is this trouble breathing and a feeling like you can't get enough air into your body, or someone sitting on your lungs, or someone described like having rubber bands around their lungs. And so that was really kind of the hallmark symptom, and also just feeling extremely tired all the time. And sometimes those got so serious that people had to go to the hospital.
So even for these cases that we don't think of as being on the very serious end of this continuum, this was something that went on for quite some time. And in some cases, they were just feeling awful.
Right. Even the person that I talked to, his name was Tom Frank. He had sort of all the people I talked to, the least severe form of this disease. Like, he was still sick for like 3 weeks and he was out. Like, you're not able to do anything. You're laid up in bed, you're sleeping all the time, and, you can't breathe. And so even a milder form can be really, really serious.
Now, we're going to play some audio from all these people that you talked to today. And I want to start with a guy you talked to named Clifford McIntyre. He described to you what it feels like to suffer from this illness. Let's listen to Clifford in his own words.
Well, the COVID feel like, you just feel like you're drowning. You in the water and you're trying to reach the top. You can't breathe, and you're panicking that you can't breathe, and your head is like worse than a migraine headache because you're not getting enough oxygen to your brain, and it's like you can't eat, you don't have an appetite, and you're real tired. And I do believe that's why a lot of older people transition to heaven, because the COVID-19 just takes over your body where you're so tired, your body can't win, and like I say, I just thank God that me and my wife, we are survivors. We made it through, and just through the grace of God, we here.
And that was Clifford McIntyre. You also talked to Melissa Stone. She's a doctoral student in cognitive neuroscience at St. Louis University. Here's what she described.
Within 24 hours, though, the sore throat got way worse. I started getting headaches. The fever got higher and higher. And it became immediately clear that I was really sick. Especially the level of fatigue was beyond what I had ever had with flu or cold. And meanwhile, I had no nasal congestion or anything, which was very bizarre for me with getting sick. And I also noticed that I had a tightness in my lungs. So it felt like the heavy duty rubber bands that you sometimes get on like vegetable produce. It felt like those were around my lungs. And I started noticing that they especially felt like they were around my right lung, and that all of my sore throat seemed to be moving to the right side.
And that was Melissa Stone describing her experience with COVID-19. She tells it so well, and this is just such a vivid description. Just hearing this, it kind of makes you terrified.
Mm-hmm. Mm-hmm. Yeah, and I really lucked out with the people that talked to me. They were so good at describing what they felt in these very understandable ways. Because, as a health reporter, I've done so much work on what's the virus doing? Like, what's the strain on hospitals? But what I thought was really missing was like, what does this actually feel like? And yeah, it's just like you can't breathe and you're wiped out and your body just sort of like breaks down for a couple weeks. Like you can't do anything. And so she was, Melissa also had pre-existing health conditions. And that made her really, worried because she, she's in neuroscience. She's a sort of in like the health field. Her husband is a doctor. And so she knew that she was at risk, and that made her even more worried that like once she started having these symptoms, she was like, oh man, I could really be in trouble here.
And yet she had kind of an interesting experience here. And again, this is Melissa Stone. She's a 28-year-old doctoral student in cognitive neuroscience at St. Louis University. She has epilepsy, and I hope I'm not going to mispronounce this. Is it Ehlers-Danlos syndrome?
Ehlers-Danlos syndrome. It's like a connective tissue disorder.
Okay. And so, she had these pretty serious pre-existing conditions. Once her COVID-19 symptoms became worse, she went to the ER. Let's listen.
The whole experience was just absolutely exhausting. And then there was such a disconnect between, the SLU care nurses who had been keeping track of my care almost daily. They had wanted me to go to the ER that day and basically told me there's no other option, you are going. And then the doctor at the ER was furious that I came in and scolded me when he came in for my consultation at the very end, and told me that I shouldn't have come in unless I was gasping for breath, and scolded me that now this room needed to be disinfected because I came in, and that I'm definitely positive and I've exposed everyone. And just me as a patient in the middle, like, who am I supposed to listen to then? Like, this was a serious like cardiac issue. And it was kind of infuriating, just not knowing what I'm supposed to do.
And that, again, was Melissa Stone. And as she says, that just seems infuriating that she was chastised by an emergency room doctor for going in. Did anyone else describe an encounter like that?
I know Clifford and his wife Cassandra had trouble, too, because they went to an emergency room at sort of like their usual hospital, and they found that, and they didn't get tested there because I think he had a history of pneumonia, and so, and also testing, especially back in last month, was very, very limited. Mm-hmm. And so a lot of people like Melissa had trouble getting tested, and so Clifford actually didn't get tested until he got to the hospital the second time. And I think it just shows like this is a very new disease. It's been around for 5 months total at this point. And a lot of people they don't know what to do on either side. The patients maybe doctors have a better idea of what they're seeing, but they're still not kind of like a standard course when it comes to treating and recognizing COVID. What happened to Melissa was really interesting because what we've been hearing is, don't go to the ER unless you have very serious symptoms because you don't want to strain the healthcare system. Mm-hmm. But the thing is, it's like when you leave that up to patients, they don't know what's serious. This is a new disease. It's not like the flu where you kind of know what to expect. With COVID, you're sick for a really long time. You have these very serious symptoms sometimes. And I would be worried. And when people are worried, they go to the ER. And people are getting a lot of mixed messages about like, do you go to the ER? Do you not go to the ER? And so every doctor that I've talked to said, if you don't know, call 911, call your primary care physician, and they'll walk you through your symptoms to see. But then what happened with Melissa was she actually went in and she was following all of these instructions.
They did tell her to come in, right?
The nurses told her to come in, and then the doctor was like, why did you come in? I think it really underscores how this is a new frontier and people don't really know like what to do sometimes. I also talked to other doctors and they said like that's unacceptable. If someone goes to the ER, you treat them like they're a member of your family and you take their concerns seriously. And so I'm not sort of excusing how that doctor reacted, but I understand that it's probably a very stressful situation for everybody at this point, especially healthcare workers. And so It shows that it's a new frontier and people don't really know exactly what to do sometimes.
Yeah, and that seems like almost the hardest part of this is people are experiencing these symptoms. We're all sort of unsure of how our own pain capacity is versus others. Like, are we feeling this more deeply? Should we go in? Are we in an emergency situation? Are we not? These people are flying blind in a disease that hasn't been in the U.S. all that long.
Exactly. Like, if I was having trouble breathing, I would probably go to the ER, right? Like, I'm very lucky that I haven't caught this disease, but I think that some people, it's like they don't know. Exactly. They don't know.
I'm curious because when we talk about this from a policy perspective, we're always trying to compare it in some ways to just the generic flu. Is this killing more people than the generic flu? How is it worse than the generic flu? Did any of the people you talked to who have actually had this, did they feel that their experiences were comparable to the flu, or did they not even bring that up?
I got the answer from a lot of people that it is like super duper flu, like flu with an attitude is what one person called it. And again, it's like flu follows a standard course and COVID doesn't. And also, from what I heard from everybody I talked to, is this was worse than anything they had ever felt. And it's understandable, right? Because it's a new virus and people's bodies haven't really built up any kind of immunity to it. And so when it hits you, you don't have any defenses to help you. And so you get really, really sick. And that's one of the things that, obviously is really, really dangerous about this virus is that people don't have immunity to it. And when they get it, it's serious, and it's more serious than the flu for a lot of people, and which is interesting. But yeah, because at the front end of the disease, even I was reporting and I was talking to people, and they said like these symptoms are virtually identical to the flu. You get a fever, you get a sore throat, you get a cough, but as this disease has progressed, you're starting to see that it does have a lot of different hallmarks than a traditional flu or even a traditional cold.
Now, you mentioned for people where this gets so much worse, and Clifford McIntyre was certainly one of those. He ended up hooked up to a ventilator. And in this next clip we're going to play, he described to you the fear he felt at this point. Let's listen.
Not being able to see my loved ones, and then just hearing people getting on ventilators, not making it out, I was extremely scared and nervous. And that was the last time I seen my wife, and the last time I seen my daughter was a day before that, and I didn't see my mom or dad or brother in like a week or two. So it was just real, just crazy and nervous and scared.
And that, again, is Clifford McIntyre. Now, he beat the coronavirus, and that makes him somewhat unusual in terms of people who get sick enough to use a ventilator. A lot of those people end up with really bad outcomes. He described to you how it feels like to have come out on the other side of this.
I don't want to wish that on nobody, even my worst enemy. I don't want to wish nothing with anything got to do with this coronavirus. Like my wife said, we stuck together, we talked about it, and when we watch the news and we hear someone that beat it, we get emotional, and we be at home clapping and hooraying, because, we know how it feels to just finally come home after being in the hospital 9 and 10 days, not being able to see no family members. I mean, it was pretty rough, but, we made it. Thank God we made it, and we doing better. And we have people we know now that's in the hospital that's fighting for COVID, and we praying for they safe home and they safe well-being so they can reunite with their family.
And that, again, was Clifford McIntyre. And how great to hear just the joy in his voice as they're hooraying. Did the other two people that you talked to, did they just have similar feelings of gratitude for being on the other side of this?
I think they just were sort of like, wow, I made it through. All the people that I talked to, it was really important for them. They were all very positive people. And so I think they just kind of kept their eye on getting through the day and getting through the next day and then the day after that. And honestly, I mean, I don't know how else you would get through something like that, especially if you were in the hospital. You can only really focus on yourself. But I know someone just, it's kind of amazing. Like, oh, I was sick, and then the day that I started feeling better, it was just like they couldn't believe it. They kept on saying like, oh my, like checking their feet, checking their temperature, because another thing that happens with COVID is like you sometimes get better after about a week and then you get worse again. And so that was what happened to a lot of people, was they were saying like, oh man, am I getting better? Like they didn't trust their recovery at first because they were worried that they could get sick again.
That it was going to come right back and get them again.
Exactly.
But at this point, they're all doing well. Do any hurdles or any major hurdles remain for your interview subjects?
I think it's, they're still recovering. Everyone I talked to, I did like social distance interviewing with them. I put a microphone on a big long pole and we wore masks. And so they were all able to like kind of meet with me and walk around and talk. But you could tell that some of them, especially, like Clifford and Cassandra, they were the people who had most recently recovered. And they were, like you could tell they were still in recovery. They were still a little tired. They were a little, obviously they didn't want me in their home because they're worried about getting sick again. And then also, like they're not going back to work. They're still sort of all recovering at this point. So it's a long recovery process, and it can take weeks and weeks and weeks.
Okay, so these people, they went through this long recovery. Some of them are still in the middle of it, but people are doing well today. Was there anything that described you or surprised you in their description of what they endured, something that you hadn't anticipated based on what you know?
I was surprised that even the people sometimes, and I mean, I don't know if this is surprising, but it's something that I think is worth mentioning, is that even people who can get really sick, it's like there's no guarantee that they can get tested. And so like, for example, like Melissa was saying, even though the doctor said I definitely have it, like she wasn't able to get a test because she didn't meet the criteria at that point. And unless some people want to get admitted to the hospital, and then it happened to Clifford too, like until he got admitted to the hospital, he didn't get a test. And so I think that's something to keep an eye on, especially as we look at reopening the state gradually, is how are we going to keep this virus contained and track where it is and keep people safe if even people who are very sick are not able to get tested. And that was something that I kept thinking about as I was reporting this.
That's an excellent point. And Sarah, in our last couple minutes here, we actually have a caller. Joe from Festus is calling in because apparently he and his wife both had the coronavirus. I'm very curious to hear about his experience.
Oh, wow.
Yeah. Joe, hi, you're on St. Louis on the Air.
Hi, yes. My wife and I both had it back in March. And I didn't know if you would want some of the things we experienced going through it.
I'd love to hear, you heard some of these other people talking about what it was like for them. How does your experience compare to that?
Well, we got through it mostly at home, but I'd say probably 90% of the way through it, it gave me pneumonia. So I had to go to the hospital. I was in the hospital for 4 days recovering from pneumonia.
Oh, my.
But we did get through. She got through it a lot better than I did. I reacted a little bit differently. I had a lot of breathing issues at the end, but she recovered, and I wound up basically having to go in for pneumonia, and they treated me for those symptoms rather than the virus itself, since it was at the end of the exposure.
And Joe,
lifespan.
You said this was in March, so this was at least a month ago at this point. How long did it take for you to feel, I actually feel like myself again?
Yeah, I would say to get through the virus where we could tell we were pretty much done with it was at least 2 weeks. But to get back to normal, the way we feel normally, is probably 4 or so.
Oh, wow.
A week, roughly. But the hospital stay, the nurses and the staff and the doctors there were just outstanding and with their concerns. And, of course, I'd never seen any of their faces because they were totally suited up. But the ICU wing was totally cornered off there. They had locked doors and everything was sealed off, and they wouldn't let any visitors come in or anybody in. But it was really weird because you'd have a really bad taste in your mouth, like a chemical metallic taste. You lost your sense of taste, your smell, your sweet and salty foods were very much amplified to where you couldn't eat them because they were either way too sweet or way too salty. Just your sensory of everything was just out of whack, pretty much.
Boy, it just sounds so weird. And that idea of being in a hospital and everyone is just in, full mask and covered and you can't see their faces, it's almost like something out of a nightmare. And Joe, it's just so great to hear that even though it took weeks and weeks, that you are feeling like yourself again, you're feeling better. Do you feel like you have a new appreciation for everyday life?
Very much so. And if I can make one last quick comment, is there was an interview on TV with a university coach that said he went through it. Mm-hmm. And he was talking about still working through it, and he only had one night of fever. And, everybody handles this differently. Mm-hmm. But when they put someone on national news saying that, it's not any worse than a common cold, that's very wrong. And to put that out there to make that statement puts everybody at ease where if they get it, it's not going to be a big deal, So I think that was wrong for that interview to go out through the public airwaves of national report.
So, Joe, you'd like to leave us with the impression this is absolutely a big deal and we should do everything we can to avoid getting it.
There's no way I could go through it again. It's the worst thing I've ever experienced. And we were blessed that we got through it, both of us, and very thankful for that. But a lot of people can't. The immune systems are compromised, the elderly, it's just a bad situation. And everybody should really take this seriously and protect themselves and each other.
Well, Joe, thank you so much for those thoughts, and thank you for sharing this with us. We're so glad you're doing well today, and your wife as well. So thank you, and good luck to you with that new lease on life now that you've run through the gauntlet on that. And I also do want to thank St. Louis Public Radio health reporter Sarah Fentem for joining us today.
Yeah, anytime.
Thank you so much. This is St. Louis on the Air on St. Louis Public Radio. That's 90.7 KWMU.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.